Hi there. This is Dr. Kathleen Mahannah. I will be starting my presentation momentarily. I am presenting today on hormones in the 40s, all about the shifts and changes that are occurring in your metabolism. So we are going live both in Facebook and on Zoom right now. For anyone who is with me in the Zoom, pop into the chat box and say hi and let me know where you are joining me from. I am in Vancouver, and I know we likely have people from all across the Lower Mainland. So I'd love to hear where you're joining us from. I also have the Facebook in front of me here. So I will be able to respond to questions and comments, both if you're posting from Facebook as well as if you're posting from live. Thanks to technology. Technology is amazing. So I'm going to give people a few more minutes. Hi, joining us from North Van. Hello. My clinic where I practice out of is located in North Van, and I see a familiar name there. Thanks for joining. I'm going to give people a few minutes to filter in on Zoom as well as on the Facebook Live before we get started. If you are watching from Facebook, pop in the comments and say hi and let me know where you are viewing from, what part of Vancouver, Greater Vancouver, or BC, because I always love hearing where people are joining us from. Just makes us feel all the more connected while we're each in our separate homes and doing a webinar. So this evening I will be Coquitlam, hello, thanks for joining. Surrey, hi everyone. Thanks for popping in. I am in Vancouver here in my home office today. I work virtually one day a week and then out of my clinic in North Van the other days of the week. So I think we are ready to get started here. So what I'm going to do is I'm going to share my screen and we will delve right into hormones in your 40s. So I'm going to share my screen. Awesome. And we will get started. So welcome everyone to our presentation this evening. My name is Dr. Kathleen Mahannah, and I am presenting today on hormones in the 40s and understanding your metabolism. I'm so thrilled to be hosted by Innovative Fitness this evening. I have been a member at Innovative for the past 3 years or so, and I used to train and work out of I did the boot camps over in the KITS location back when I was a student. So I'm so thrilled to be contributing and giving back to Innovative Fitness and the community. So thank you for being here and joining me this evening. So a little bit about myself. For those of you I haven't met, my name is Dr. Kathleen Mahannah. I am a naturopathic doctor, and I work out of a clinic called Restoration Health Clinic in North Vancouver. So a little about me and my background and what brought me to naturopathic medicine. I grew up in North Vancouver. I am a volleyball athlete by training. I competed in varsity volleyball in both college and university. I obtained my diploma of exercise science at Capilano College, and then I went on to University of Toronto and I completed my Bachelor of Kinesiology, all the while playing volleyball. So I have been very well acquainted with the personal training world for many, many years through my volleyball career. When I moved back to Vancouver in 2010, I then went on to study naturopathic medicine at the Boucher Institute, which is in New Westminster. So the naturopathic medical program is a 4-year program. And now I've been in practice ever since. And my particular focus in my practice is women's health and hormones. So all day, every day, I have the pleasure of working with women all across the lifespan, from childhood to teens to fertility and pregnancy up into perimenopause, menopause, and beyond. So I'm very excited to be chatting with you about hormones and metabolism this evening. Now, for those of you who have never seen a naturopathic doctor before, perhaps if you don't know what naturopathic medicine is, I want to provide a little bit more of a description. So naturopathic doctors are licensed healthcare providers. In British Columbia, we are able to do lab testing, so blood testing, the way that family doctors do. We are able to work up and diagnose and help to treat both acute and chronic conditions. In British Columbia, we can also prescribe medicine. So that is absolutely part of my practice, to prescribe medicine as well as hormone therapy to my patients. However, as a naturopathic doctor, my real goal and passion is to treat people with natural medicine where possible. So this means I do a lot of work in diet, nutrition. I'm trained in herbal medicine. I'm trained in acupuncture. I do a lot of lifestyle coaching for my patients. And my ultimate goal with my patients is to always find the root cause of health concerns or imbalances. And if we can really identify what that root cause is, we can treat it effectively and get you feeling better. And that's really going to be the theme of this evening as we go through hormones and metabolism for women in their 40s. So here we are. This is what we are going to be covering this evening. I'm going to start off by chatting about what I call hormones 101. So what is shifting and changing in your 40s with your estrogen and progesterone? So these are our primary hormones that we'll be discussing. Now, once we have an understanding of what's shifting and changing with those hormones, we can then understand the other downstream effects that happen elsewhere in the body and with other hormones, namely what I call hormones 201, our cortisol, which is our stress hormone, the thyroid, insulin, and melatonin. In other words, our sleep. So all of these different hormones influence our metabolism and what is shifting and changing with weight and metabolism in these years. I'll touch on various types of hormone testing. So these will be things that you can complete either with your family doctor or your naturopathic doctor. And I'll also provide an outline for how I approach treating my patients and balancing hormones and supporting metabolism from a naturopathic perspective. We'll kind of go through this in about 40 minutes or so, and then we will delve into Q&A time. So I'll be able to take questions live from Zoom, and I aim to also take questions from the Facebook live as well. So if you have any questions as we're moving through the presentation, pop them into the Q&A section on Zoom or pop them into the comment section on Facebook, and I will look at them at the end of the presentation. All right, so now I wanted to start off by providing you with kind of the typical patient that I see in her 40s that enters my office and the concerns that she comes in with. So this is an example patient. Her name's Katie. Katie is 45 years old. She's a mother of 2 kids. She runs a family business. So stress is super high, but she pushes through. She's managed. She always seems to manage, and she just gets her done one way or the other, as is required if you're running a business. So Katie comes into my office and she reports that she has been on the same diet. No major changes have shifted in what she's eating. She's doing the same type of exercise as she's always done, but now she's been gaining 5 to 10 pounds a year for the last 2 years. And in particular, it seems to be around the midsection stomach area. When we dig a little deeper, Katie also describes that she's got some other changes happening, such as new onset sleep disturbances, so difficulty with falling asleep and staying asleep, where that didn't used to be a problem for her. She reports that her PMS has gotten way worse, so feeling a lot more irritable. Her periods are way heavier. She's feeling super exhausted, and she is fighting off these cravings for carbs and sugar all the time. So this is a very typical, common scenario that I see for women, that case of, I'm doing all the same things, I'm eating the same stuff, exercising the same way, and yet somehow I'm still gaining weight. What is going on? So this is where we delve into hormones 101. So as we delve in here, there's a few terms that I really want to clarify for people before we delve into what's shifting and changing with estrogen and progesterone. So first of all, the term premenopause. So this is the time period from puberty to perimenopause, where estrogen and progesterone are fluctuating as we would expect them to be. They're relatively balanced, and we have a menstrual cycle pretty much every month for the majority of our lifetime. Where things start to shift and change is typically in the 40s, in the perimenopause timeframe. Perimenopause is a time of life. It's not a diagnosis, it's a time of life, which is defined as the years leading up to menopause. Now, perimenopause is a time span that can be anywhere from up to 7 to 14 years long. This is not commonly understood with a lot of women. The average age for perimenopause is between about 39 to 50 or so. So for women in their 40s, with the shifts and changes that are happening, this is likely part of perimenopause, and I'm going to delve more into that in a second. Now, menopause, the definition of menopause, again, it's not a diagnosis. Menopause is a point in life that we reach, a point in time that occurs after 12 months beyond your final menstrual period. So the average age for menopause is around 51, meaning that for a woman around age 50, when she has her last period, then 1 year later, that point in time is called menopause. Once a woman hits menopause, the time span beyond that for the rest of her beautiful life, that's called postmenopause. So that's the time period after menopause has been reached. So with this in mind, I want to clarify a little bit more what exactly perimenopause means, and then we'll delve into what that might mean for you. So again, I'm going to point out that perimenopause is not a diagnosis. This is a time in life for women. Despite that, and that's why I put diagnosis in quotation marks here. So one question that we received before this presentation is, how do I know if I'm in perimenopause? So this is how you know. We can tell if you're in perimenopause if you are in midlife, so again, in your 40s, in women who still has a regular menstrual cycle, and if you're experiencing any 3 of these following 9 changes on this list. So if you're having any 3 of new onset, heavy or longer period, if your menstrual cycle has suddenly become shorter, so less than 25 days, if you're suddenly having new breast symptoms like sore or swollen or lumpy breasts, if you find that you're having, you're waking up in the middle of the night, whereas that was not an issue for you before, if your cramps, your menstrual cramps are getting worse, if you find that you're getting night sweats, particularly in that week leading up to your period, in that premenstrual phase, if you're having any new or markedly increased migraines, or if you're having any new or increased PMS mood swings, so feeling a lot more irritable or more anxious or more depressed in that PMS phase, or if you're having weight gain without any other changes in your exercise and eating. So if you are a woman listening in and you have any 3 symptoms or signs on this list, that indicates that you are in perimenopause. And what this means is this really helps guide next steps in how we can support your symptoms and support balancing your hormones and your metabolism. So to delve more into what exactly is happening in perimenopause, there are shifts and changes in your estrogen and progesterone that are occurring during this phase of life. Now, for our premenopausal years, in our 20s and 30s and early 40s, typically estrogen and progesterone balance out one another. Estrogen is our building hormone. It helps to build the lining of the uterus. Estrogen is energizing for us. We should feel good energy in the first half of our menstrual cycle. It helps to support a healthy libido. It helps to support our fertility. Estrogen is responsible for the female features like breasts and hips. Progesterone is our calming, cooling hormone, is how I like to describe it. Progesterone balances out our estrogen. When progesterone is being produced in adequate levels, this helps to keep our mood nice and stable. It keeps our sleep nice and deep, and it keeps our PMS symptoms in check. So when progesterone starts to decline, that's when we start to see shifts and changes in our hormone symptoms. Now, so how exactly do these shift and change in the 40s? Well, what we previously understood, what we previously thought with menopause and perimenopause, we thought that estrogen would just slowly decline through your 40s until it hits a kind of critical low point, and then your period disappears, and then you're menopausal. That's what we previously thought. Now we've come to understand that that's not exactly what's happening. Instead of estrogen just declining slowly, what we understand is estrogen production actually becomes a lot more erratic or unreliable during the menstrual cycle. So instead of a nice smooth shift and change throughout the month, it's kind of like I describe it like the grand finale of a fireworks show. It's like some days it's exploding and super high, other days it's really low, and it's kind of very unpredictable in its pattern of production throughout the month. So in fact, we actually tend to have elevated estrogen patterns in our 40s during perimenopause. In contrast, where normally progesterone is our calming, soothing hormone that helps to balance estrogen, progesterone declines sharply in the 40s. Our progesterone production peaks in our late 20s and early 30s. So often progesterone is in fact declining in our late 30s. So when we have low progesterone, that's when we start seeing hormone symptoms like worsened PMS, irritability, anxiety, sleep disturbances. Those are all signs of our progesterone dropping off and our estrogen being erratic in its production. So in summary, the patterns we tend to see for women in their 40s is a pattern of elevated estrogen and low progesterone. So again, to highlight some of the key signs: heavy menstrual flow, worsened PMS symptoms, sleep problems, insomnia, mood swings, worsened anxiety, breast tenderness, metabolism changes, and weight gain. Those are all classic signs of elevated estrogen and low progesterone, especially for women in their 40s. So I want to distinguish here between the signs of early perimenopause and late perimenopause. Early perimenopause can start in your early 40s, and you can see here on the list can involve symptoms like more irritability or for feeling more angry, pervasive depression or low mood, migraines, changes in your menstrual flow, often much more heavy, fertility challenges, sleep issues, insomnia, worsened PMS, weight gain, low libido. Those are typically what we start seeing early in the perimenopause journey. In contrast, some of those classic menopause or perimenopause symptoms that you hear about, like the hot flashes and night sweats and insomnia, those are much later symptoms of or signs of perimenopause. Usually those are the last 1 to 3 years before we hit that menopause time frame around, on average, age 51. So the skipped periods, hot flashes, insomnia, weight changes, typically those are associated with the late perimenopause time. So now that we've got an outline of what's happening with your estrogen and progesterone, now we have the foundation to understand when those hormone shifts are changing and fluctuating, what can happen in our other hormones that influence our metabolism. So I am going to be delving more into what shifts and changes with your cortisol, which is your stress hormone, your thyroid, insulin, and your melatonin, which is representing your sleep. So as you can see here in this image with perimenopause, some of those symptoms that we think of for perimenopause also overlap with thyroid problems or insulin problems. So this is where testing and a thorough workup with your medical doctor or your naturopathic doctor becomes really important. So we're targeting the right treatment for the right symptoms for you. So starting with cortisol. So cortisol is a normal, healthy hormone for us to be producing during the day. Now, our cortisol goes through a particular pattern of production throughout the day. It's associated with our circadian rhythm or our sleep-wake cycle. Here on the left, this little graph, the blue area that you see on this graph here, that represents the normal range that we would expect cortisol to be in during different phases of the day. So as you can see, cortisol production should be highest first thing in the morning. This helps us wake up, pop out of bed, and feel energized first thing in the morning. As the day progresses, cortisol declines slowly, such that at nighttime, cortisol should be nice and low. We feel tired, we fall asleep, and we don't have any sleep disruption. Now, when we have acute stress or chronic stressors, our circadian rhythm or cortisol production can become dysregulated. Now, on this little graph here, you can see these little black dots. These are representing test samples for a sample patient, and we can actually use a saliva sample to map out where their cortisol production is at 4 different points during the day. And this is useful for us to understand what's happening with cortisol. So with stress, and especially for women in their 40s these days, many women are managing, a family, kids, sometimes young children, a business, or working part-time or full-time, managing a relationship or relationships, perhaps aging patients, parents that they're taking care of. Women in their 40s, especially these days, are managing a lot. So I can tell you with a high degree of confidence that almost all of my women in their 40s that I see in my practice have some sort of cortisol symptoms that we need to address. So symptoms of elevated cortisol, as depicted in this little picture here, can include things like feeling anxious or jittery, having difficulty winding down, especially at night. For women who have difficulty falling asleep or staying asleep, that's that elevated cortisol at nighttime. Another common symptom is that busy, overactive mind as soon as you lay down in bed, or feeling really tired and exhausted. Your body's tired, but your mind is wired and you can't get to sleep. Sugar and salt cravings are common signs of dysregulated cortisol. Other symptoms can include IBS or indigestion, foggy brain, meaning difficulty concentrating, feeling that you just don't have that same ability to cope the way you did previously with all the things you're managing in your life. And in particular, cortisol is a contributing factor to that weight gain around the midsection and around the waist. That's a classic cortisol sign. Now, how this particularly relates to women in their 40s is when estrogen is elevated or erratic in its production, cortisol and adrenaline tend to go along for the ride, meaning that when estrogen is high, cortisol also tends to be high. So this leads to sleep disruption, dysregulated cortisol production, worsened mood, fatigue, irritability, etc. So these are the common signs of elevated cortisol symptoms that we see early on before the next phase that tends to occur, which is the signs of low cortisol, meaning burnout, to use a common term for it. Now, when we look at this little chart here on the left, you can see the little sample patient, their black dots, their samples are low outside that normal cortisol curve, meaning that their body isn't producing enough cortisol anymore. Now, just last year, in 2019, the World Health Organization formally created a term to describe, or a definition of, workplace burnout. And the World Health Organization defined workplace burnout as a combination of exhaustion, decreased work productivity and performance, and cynicism or negativity. Now, this is defined as a workplace phenomenon and not yet as a health phenomenon, but how many people have observed or perhaps can identify with feeling exhausted, feeling like you're not putting out as much at work or perhaps in your personal life or your exercise performance, and feeling negative or down or cynical about it. These are symptoms or signs of burnout. Other things that we can see alongside those burnout symptoms are depression, weight gain, low libido, infertility, chronic pain, insomnia, so difficulty sleeping or excessive sleep, or getting sick frequently, kind of catching every cold and flu that goes around, or having really poor recovery from exercise or training. That can be a sign of burnout. So cortisol is a very important hormone for us to recognize and address when it comes to supporting hormones and supporting metabolism. So in our patient that I told you about in the beginning of this presentation, Katie, 45 years old, when we looked more closely at her cortisol levels, it very clearly showed that she was in this burnout phase. And we'll talk more in a bit about how we address that. So the next hormone that I want to highlight for you is the thyroid hormone. So the thyroid is our master metabolism hormone. We absolutely need to have a healthy, optimal thyroid function in order to have good metabolism. So what I want to highlight here are a couple things. Firstly, the signs that you might have low thyroid function or you're trending towards a sluggish thyroid or hypothyroidism would be signs like fatigue, weight gain, heavy periods, dry skin, constipation, or hair loss. Those are all classic signs that your thyroid needs to be tested. And this is something that your family doctor can do for you, or we can do this as naturopathic doctors. Now, one thing I want to highlight here is when we screen your TSH, the blood test is called TSH. This is a screening test for your thyroid hormone. The medical range of normal for TSH is anywhere from approximately 0.5 to 5. And if your TSH falls within that range, you're considered normal, or there's no diseases going on, or there's no hypothyroidism, which is good to screen, and it's good to know that we can rule out hypothyroidism. However, from my perspective as a naturopathic doctor, I want to know that you're not just within normal limits or that you're disease-free. I want to know that your thyroid is optimal. So my definition of a healthy, optimal TSH range is much more narrow than the conventional standards. So when I screen patients' TSH, I like to see that it's in that healthy, optimal zone. When I screen for thyroid function, I also like to screen a few other associated hormones. So our active thyroid hormones are called free T3, free T4. So I like to screen those all at the same time to get a thorough picture of what's happening with the thyroid. And I also like to screen another test called ATPO, or antithyroid peroxidase antibodies. This is a test that screens for any autoimmune concerns that might be brewing in the thyroid. The reason I highlight this is because there's a few times in a woman's life where the thyroid is a bit more likely to go awry, and that's during periods of hormone transition. So puberty, pregnancy, postpartum, and perimenopause. These are times in a woman's life where she's a bit more likely for things to go awry with the thyroid. For that reason, I do like to screen that a little bit more frequently, every 1 or 2 years throughout the perimenopause transition. And that's, again, a simple blood test that can be done. If we do see any of those antibodies present, then we can take action on that. And I have a particular treatment protocol that I support women through to help with those thyroid antibodies. So thyroid hormone, absolutely very critical to have this screen to better understand what's happening with your metabolism and what might be happening or contributing to any weight gain you're experiencing. Now, the next hormone I want to highlight is insulin. And insulin is a hormone that is responsible for supporting our storage of sugar and for supporting healthy, optimal blood sugar levels. So signs of problems with insulin, meaning insulin is increasing or our body cells aren't listening to insulin as well as it should be. This is called insulin resistance, otherwise known as prediabetes. So some signs that may indicate that there might be some insulin resistance occurring could be weight gain, again, especially around the midsection, fatigue, cravings for carbs, or that feeling of hangry, like you have to eat every 2 hours or else you're going to be really irritable. Facial hair, elevated blood sugar or elevated cholesterol on your standard screening with your GP, or for women who have a history of polycystic ovarian syndrome or a history of gestational diabetes, this puts you at a slightly higher risk of insulin resistance. So we can absolutely test for this in a standard blood test with your family doctor or again with a naturopathic doctor. Those would be your fasting glucose or your fasting sugar, your cholesterol, another marker called hemoglobin A1C. I also like to screen your fasting insulin directly. So these are all blood tests that give us greater insight into how is your body managing your insulin levels. Now, in our patient, Katie, our 45-year-old patient, when we screened her thyroid, we figured out that her TSH was elevated, so trending towards hypothyroidism, although she didn't meet the diagnostic criteria of hypothyroid. And when we looked more closely and examined her diet and her energy levels and her blood sugar, we determined that she had a trend towards this insulin resistance. She described, when we looked at her diet more closely, that in the morning she would grab a cup of coffee, grab a scone, run out the door to take her kids to school. Then she wouldn't eat until 2 p.m. when she would be feeling absolutely ravenous. She'd have a big bowl of rice or like a Buddha bowl with veggies on it. 2 hours later, her energy would totally crash. That's that poor energy in the afternoon that can be a sign of insulin issues. And then later in the day, she would come home from work and they would have, pasta or starchy veggies with their other vegetables. So higher carb diets, sometimes that can affect our insulin or blood sugar levels if our other hormones aren't aligned to deal with them very well. So insulin and blood sugar is absolutely something that I recommend screening if you have any concerns with weight gain. Now, melatonin, or our sleep. Sleep is so incredibly important for our hormones, for recovery, and for our mental health and well-being. Studies show that when we have acute or chronic sleep deprivation, this increases our blood sugar and increases our insulin, which promotes weight gain in the coming days or months. Now, when we are sleep deprived, again, whether this is, we have young kids and they're not sleeping through the night, or perhaps we're going through a high stress time in our lives, that stress or sleep disruption can impair our hunger hormones and our feeling full hormones the next day. Meaning, when we eat the next day, we actually feel more hungry than we actually are, and our body doesn't have that same signal for feeling full or stopping eating, which means we tend to overeat when we're sleep deprived. And it's no wonder our bodies are tired, our bodies are craving energy to try and fuel us throughout the day. Sleep apnea, which is a form of severe snoring, also worsens our blood sugar and insulin. So for anyone who has sleep apnea, this is something that we want to address to help to support your sleep quality and also to help to support your metabolism. So in fact, sleep is actually a really important part of our metabolism. And this is a lesser known fact. And this is something I spend a lot of time educating women on. So especially for women who have a double whammy of, changes in the hormones, which is contributing to sleep issues, or stress, cortisol, which is contributing to sleep issues. That common thread that we want to address to help to support metabolism is actually our sleep quality. So I do lots of work with patients in and around supporting sleep quality to get them feeling better, to get them more energy, and to help to support their metabolism. So in summary, with our patient Katie that I've described, after reviewing her symptoms, having our intake with her and looking at her blood tests, we determined that she was in fact in perimenopause. She was in a burnout state. She didn't have hypothyroidism, but she did have suboptimal thyroid function, which was impacting her metabolism. And she was trending towards insulin resistance, and she was having sleep disturbances, which is really compounding everything. Now, this may sound, doom and gloom, but the good news here is with Katie, we were able to really pinpoint what are the particular problems that are contributing to her weight gain issues, which meant we could get really specific and targeted with our treatments and support for her and getting her feeling better and supporting her metabolism. Okay. So one of the take-home messages that I want for you out of this presentation is you getting yourself tested either with your medical doctor or with your naturopathic doctor, knowing your baselines and having that checked annually or every 2 years so we can monitor and identify shifts and changes early and support them early on. Most of the tests I've described can be done with simple blood tests with your family doctor or your ND at Life Labs. There are some other particular comprehensive hormone tests that I sometimes do with my patients in my clinic. There's one in particular, it's called the Comprehensive Urinary Hormone Assessment. And this is a little picture of what some of the results look like. What I love about this test, this urinary test, is we can look at not only your estrogen and progesterone, but also your cortisol, testosterone, DHEA, thyroid hormone metabolites, melatonin, as well as about 30 other urinary hormone metabolites, which gives us really great insight into the hormones that your body is producing and how your body and your liver are metabolizing and breaking those down. And with that information, again, we can get really specific and where we need to start and what areas we need to support your body in supporting your hormones and supporting your metabolism. So I just wanted to highlight that there are some other more comprehensive tests that we can do as naturopathic doctors to understand your hormones. So with this in mind, where do you start? If you've got, a list of these perimenopause symptoms occurring for you, where would you want to start in order to help supporting your body? First and foremost, number one is testing and assessment. As I've highlighted, we want to understand what specifically is happening with your hormones and with your body, and where will the best place be for us to start and really target in supporting you and feeling better. Now, for me as a naturopathic doctor, I like to take a holistic view of you and your health in the context of your life, in the context of your goals, so we can set a really strong foundation and make sure we're able to achieve those goals for you. So at the bottom of this foundation, I always typically start in this realm, and that's how can we get you resting better, recovering better? How can we improve your sleep? How can we support your digestion, meaning ensuring you're absorbing your nutrients from your healthy diet? And what can we do to support your self-care? Now, self-care is, kind of a token term these days. I use self-care as a term to describe, how do you take care of you? In what areas of life do you put yourself at the top of the to-do list to have that rest and recovery time? That could look like, having a hot bubble bath a couple times a week, or it could look like you going to yoga or you going to counseling. That also could look like you getting some infrastructure support in your household with your family. For example, hiring a meal delivery service to take away the stress of meal prep for you every single week. Or perhaps, enlisting the support of another family member for helping to drive your kids around, or whatever that looks like for you, to help to strategize and mitigate some of those little daily stressors that add up to that overall stress response. When we can create and support that healthy foundation, we then look more closely at how can we support you from a dietary perspective and a nutrition perspective. So often patients want to know, what are the best foods for my hormones, or what are the best foods for my insulin or my blood sugar? And I have answers to all those questions, and really ultimately it depends on you and your test results. If we see that your body's trending towards insulin resistance, then we want to do a dietary nutrition plan that's really supportive for that. If we see that your body's trending towards, burnout or a thyroid imbalance, then we really want to up the specific foods that help to nourish you in those areas. One question I got before this presentation started was, does intermittent fasting help with perimenopausal ups and downs or other specific foods? Intermittent fasting is such a hot topic, and intermittent fasting can work great in some cases, but not in all cases. So it's not a one size fits all. Intermittent fasting can be really beneficial for people who have blood sugar challenges or cholesterol challenges or insulin resistance. However, especially the caveat I just want you to be aware of as a woman in your 40s or 50s is intermittent fasting when you're already burnt out isn't good for your hormones. So if you're someone who, if you identify or if you know that you're in that burnout phase, your body would actually benefit from more regular meals and more regular timed delivery of nutrition during the day, as opposed to that more strict fasting time during the day. So again, this all boils down to really creating a tailored treatment plan based on you and your hormone results. Diet and nutrition form a really important foundation in my practice with my patients. We then look at exercise and movement. Of course, here you are in the innovative fitness, community here. And I know the team at IF does such a great job of tailoring your exercise specifically to you. What this also includes is how we might need to shift and change your exercise based on your hormone results. If you're someone who's really burnt out, you would actually more likely benefit from lower intensity, more repetitive movements like cycling or less of the high intensity interval training. Whereas if your cortisol is doing good, but your insulin is elevated, that high intensity interval training is excellent for you. So I work with, I collaborate with the trainers at the IF gym in North Van, and I can help to tailor some of those particular recommendations for patients based on their hormone results. The next layer is how do we add supplements or specific nutrients or herbs based on your unique profile, hormone profile. And again, there's lots that we can look at in this realm, whether that's herbs to support your stress response or high doses of specific vitamins and minerals to support your energy and metabolism. So again, that's another important layer that we look at once we know for you specifically what do you need. The next layer at the very top is hormone therapy. So this I'm referring to as bioidentical hormone replacement therapy, or BHRT. And this is sometimes an option for women who have really bothersome perimenopause symptoms. For example, the really extremely heavy periods or the really severe PMS symptoms. If we've tried everything else and or if we want to turn towards more of the hormone therapy, that's an option for us. So I always do have that conversation for women in their 40s so they understand what are the options. Now, that's not to say they necessarily need to do that, but at least they have, I want you to have an informed conversation about what that could look like for you and the safety and efficacy of that potential option. So this is all to say that we've got lots of tools that we play with as naturopathic doctors in order to help to support our patients in their goals of feeling better, supporting energy, navigating perimenopause effectively and feeling good during this phase of life, and with supporting metabolism. So I wanted to highlight just some of the, the top 5 most common conversations or some of the common recommendations that I have with my patients in their 40s. And again, I want to emphasize that I highly recommend that you chat with your medical doctor, or chat with your naturopathic doctor so you can know what is best for you. Highlight number 1 is that rest and recovery piece. Protect your sleep. This is the most important thing. Sleep is such a keystone for our mental health, our hormones, recovery, and metabolism. So whether that looks like changing up your sleep routine, supporting sleep hygiene, or taking a specific supplement to help support your sleep, whatever that might look like, sleep is very important for your hormones. Number 2, as I outlined previously, really reflecting on the stressors in your life and coming up with strategies to help mitigate them. And again, that could be stress coping mechanisms, that could be counseling or support, that could be specific herbs or nutrients, or it could be delegating, or it could mean saying no to more things. But that's a really important conversation, especially for women in their 40s. Again, who are managing so much on their plate at this phase in life, in this generation, and where we are in a pandemic these days. Number 3 is that tailored nutrition program to suit your specific hormone and metabolism needs. This is something that I spend a lot of time with patients, and if people have specific questions, I can answer some more in this realm here, but that nutrition piece and getting that tailored to you specifically is really important. One of the top vitamins and minerals that I find myself talking about a lot and prescribing a lot in my practice is magnesium, and specifically magnesium glycinate. Magnesium is a mineral that many of us are deficient in these days, just given the state of our soils. Magnesium is important for hormone metabolism, it's important for our mental health, and it's a calming, relaxing nutrient. So magnesium is great for people who are anxious, for people who have muscle tension, sleep issues, or insomnia. It can really gently help to support your sleep. It's also important for our estrogen metabolism and our progesterone metabolism. So one of the most common nutrients that I find myself prescribing in my practice. In terms of my favorite herb, or one of the most commonly talked about herbs in my practice, this is actually a family of herbs. They're called adaptogens. And adaptogen herbs help us adapt to stress better. One example of these herbs is called ashwagandha. This is one of my favorite ones. Now, adaptogen herbs, we can tailor our recommendations based on where you're at in that stress curve. If you're really on that burnt out side, we have some really good energizing, building adaptogen herbs. If you're more kind of like the wound up, anxious, stressed, sleep deprived stage, there are some really calming, cooling adaptogen herbs. So again, we can get really specific in the types of herbs that we're tailoring for you based on where you're at. Ashwagandha is one of my favorites. Ashwagandha is slightly calming for us, so it's really lovely to take at nighttime to help with sleep, and it's good to help gently support our energy, good sleep, good deep sleep, and help to support our resilience to stress. So there's some of the most common recommendations that I find myself talking about for my patients in their 40s. Okay. So we have covered a lot of ground today, and I just wanted to end with, how to connect with me. If you have any questions, we're going to move to the Q&A section in a moment here. If you have any questions for me specifically, or if you wanted to reach out or find me, the clinic I work out of is called Restoration Health Clinic. It's located in Lynn Valley in North Vancouver. These days, I'm doing both in-person and virtual visits. So I am able to see patients all across the Lower Mainland. And you can find me on Instagram. I post lots of, hormone balancing information on Instagram, and I put my website there at the top. So what I want to do now is I will answer any other questions that you may have. And let me do that here. I'm going to stop sharing my screen, and I'm going to start with any questions. Oh yeah, okay, great. I have a few questions here in Zoom. So the first question, burnout is synonymous with adrenal fatigue. Yes, so adrenal fatigue, I use air quotes because that's not a true definition or true description or a true diagnosis, but the common term is adrenal fatigue. So adrenal fatigue does describe a spectrum of burnout. And I described, we can be more in the anxious, jittery, sleepless section or stage, or we can be further along in that burnout stage. So that all describes adrenal fatigue. A more correct term is hypothalamic pituitary adrenal axis dysregulation. So a fancy term for our adrenal glands and our brain not communicating as effectively as they should because of stress and burnout. So yes, that is what I'm referring to. Second question, does the ketogenic diet affect female hormone levels? Great question. Thank you for asking this. Does it affect female hormone levels? It can. Now, some females can do well on the ketogenic diet for a period if they're the type of bodies or the type of metabolism where they tend to have insulin or blood sugar issues. So women who may have syndromes like polycystic ovarian syndrome, where blood sugar is a bit of an issue, some of those women may do well on the ketogenic diet for a period of time. For women who are more in the burnout phase and they're running themselves to the ground, super busy and stressed, and on the keto diet, yes, that can affect female hormones, and I have seen that in my practice. What tends to happen is women actually need more carbohydrates than men do. A lot of male bodies respond really well to the keto diet, and sometimes female bodies don't respond as well as we might hope. So sometimes we see that for women who are in their burnout phase, they're not getting enough carbs to actually fuel their hormones. So sometimes we see, sporadic periods or period problems or hair loss or feeling more exhausted than they should. So yes, sometimes we do see that with the keto diet. So while the keto diet can be good for some people, it's not necessarily good for everyone. Next question. Do you notice a great difference in hormone imbalances in women who have used the birth control pill long-term versus women who have not used the pill or only use it for a short period of time? Really good question. Sometimes, yes. Sometimes I do see that women who have been on the pill for a long time, typically what happens with those women, something I commonly see is women or girls, when you're a teenager and you've got super heavy periods or really bad acne, you were given the birth control pill to help control the symptoms. I was one of those girls. And what happens with those women is they stay on the pill for so long because they're afraid of coming off due to acne or hormone issues or cramps or whatever it is. So they stay on the pill for a really long time, which is effectively masking their hormone symptoms, which is fine in that it's controlling those. But later in life, when they decide to come off the pill, what happens is often those symptoms will return. And now, for example, a common thing that I see in my practice is, women age 35, she wants to start a family, she's been on the pill for 15 years, she comes off the pill, and suddenly we have all these hormone symptoms that we're dealing with because they've just been masked for so long. So the other thing is that the birth control pill can contribute to some nutrient deficiencies, most notably vitamin B6, which is a vitamin that is important for hormone balance, serotonin production. That's our happy neurotransmitter. So sometimes, often when I have women who are coming off the pill or who are on the pill, we want to do some extra work to help support some of those specific nutrients. Okay, I had a few other earlier questions that were submitted. One question was, how do I know if I'm perimenopausal? So we covered that in this presentation. There was that slide earlier outlining all the signs of perimenopause. And next question was, I understand that from pre-menopause to menopause, there are a few stages and the body keeps changing. How can I manage these symptoms? And that's something that I really hope was a takeaway for you in this presentation, which is there are lots of changes happening. And the most important thing to start with is getting yourself tested and working with a practitioner who can really answer those questions for you. I really want to highlight at this point that with perimenopause, our understanding of perimenopause is shifting and changing in real time. It's only been very recently that we've really, in the research literature, come to understand or start to understand what's happening with the hormones. So actually, for a lot of medical doctors or healthcare practitioners who perhaps have been, if they were trained 20, 30 years ago, they didn't learn about what perimenopause is, and therefore don't have the knowledge to perhaps support you or answer your questions as effectively as some other types of practitioners. So what I want to emphasize here is, if you certainly absolutely go to your medical doctor, ask for testing, ask questions, but always seek a second opinion. If you walk away from any type of practitioner and you feel like your questions weren't answered, or you feel like, you were offered, let's say the pill to help to control your symptoms, if you feel like there are still other options or things that you want to explore, or perhaps other avenues to go down, do follow that intuition and do follow up with a naturopathic doctor or another practitioner who can really delve into the nuances of perimenopause and hormones with you. So commonly I see women suffering through their hormone symptoms, and that's something I really want to advocate and support women in, is seek support. You don't have to struggle with disruptive periods or metabolism changes or feeling exhausted all the time. There are things we can do to support you. Okay. Can pregnancy still, another great important question, can pregnancy still occur during perimenopause? Yes, it can. Yes, it can. So during perimenopause, when estrogen is fluctuating and progesterone is unreliable, ovulation is also unreliable. And sometimes we ovulate and sometimes we don't in our 40s. So this means that you still can get pregnant in perimenopause. So yes, thank you for asking that question. So that means that you do still want to use some form of contraception if you're looking to avoid pregnancy during those years. Okay, now let me see if I'm able to look at any questions on the Facebook group. I see someone joined from Grand Prairie. Thanks for joining us. Okay, so I'm not seeing any other questions right now on the Facebook group. Oh, one more question here. What is a good natural treatment for hair loss? Good question. So step one with hair loss is, why is hair loss occurring? We need to get to the root cause of the hair loss to understand how to best treat it. Common causes of hair loss can be thyroid issues, iron deficiency, shifts and changes in hormones, and stress. So we want to understand which of those things is causing the hair loss so that we can then treat it effectively. With my patients who have hair loss, I always screen thyroid, always look very closely at your iron levels, especially if you have really heavy periods. And we take a good close look at stress and how that's feeling and working to understand what's contributing to that hair loss. From there, then we can provide specific recommendations for, iron supplementation or biotin or other specific nutrients, collagen, stress support, other hormone support to help with hair loss. So we want to make sure that you're getting all the building blocks, nutrients that your body needs to help good, healthy hair. So I hope that helps to answer your question for you. Okay, I'm pulling up any last questions at the 11th hour here. I think I have addressed everything that I see here. And we're just shy of 1 hour, so I'm going to close up this conversation. Thank you so much for joining me this evening. I love talking about hormones, so I'm so thrilled to get to join you. I'm so happy to be hosted by Innovative Fitness. So thank you to Innovative for having me here in your Facebook Live today. And again, if you want to reach out and find me, we'll put my contact information in the Facebook group in case you want to reach out and chat, or if you have any other specific questions for me. And again, I'm in North Vancouver Restoration Health Clinic. Find me over on Instagram. And thank you so much. Have a wonderful rest of your evening.